Hi, I'm Dr. Massey. Today we're going to go over the procedure for having your braces removed and about retainers and how to take care of them and clean them and how you should wear them. So the process for removing the braces starts with eye protection. Make sure you're nice and safe. Then we use a special instrument to remove the brackets. And then we basically just give you a rinse and start polishing the glue off the teeth. This is the same process as for Invisalign. We start off with the eye protection. Of course, there are no brackets to remove. We just go straight to polishing the attachments off of your teeth. Then after we're done with that, depending on what kind of retainer you're going to be getting, we either take an iTero scan of your teeth or we take an alginate impression, kind of the old-fashioned impressions for your teeth, to make retainers. And it's not so bad, we have different flavors and things like that to try to make it as pleasant as possible for you. But we need to take those models so that we have something to make the retainers from. So after you're done with your orthodontic treatment, whether you have braces or Invisalign, anybody who goes through orthodontic treatment gets retainers. And the retainers are very, very important. They are just as important as the treatment itself. Because what the retainers do is they retain or hold your teeth in the positions that we've moved them into. So when we're moving your teeth with orthodontics, they're tiny little fibers that hold the roots of your teeth into the bone. And those fibers are kind of like rubber bands. And we've been moving your teeth and rotating them and closing the gaps and all this kind of stuff during treatment. And those fibers are getting stretched and they're getting moved into different positions as the teeth are moving into different positions. And so because they're like tiny little rubber bands all along the roots of your teeth, when we move a tooth with the braces or Invisalign and then remove the braces or the Invisalign, they want to snap back. So your teeth want to go back to the position that they were previously in. This happens especially very quickly in the first 2 years after you're done with treatment. Those fibers it takes them about 2 years for your body to kind of relax into the new orientation of your teeth. So the first 2 years are very, very crucial. You cannot even miss one night with your retainers or else you'll feel the next day your teeth will move. When you go to put your retainers in, they're gonna feel sore. So that's very, very important. Now there are 3 different kinds of retainers. One is a permanent retainer, and that's a little wire that we bond, just like we bond the braces. We bond the wire behind your teeth to hold the teeth in place. Those are just for the front teeth. They don't extend all the way to the back. And each type of retainer has its pros and cons. For this particular type of retainer, it does make it very, very difficult to floss your teeth. It makes it so that plaque and tartar gets attracted to it and sticks on it. So I personally don't recommend this kind unless you really, really need it. Some people really need it. For example, if you started off with a huge gap in the middle of your 2 front teeth on top, that's the whole reason you got braces or Invisalign to begin with. I might want to put a little permanent wire behind those 2 top teeth to keep that space closed up. The next kind is a Hawley retainer, and it looks like this. It's kind of the more traditional, has the wire in the front with the acrylic, covers the roof of your mouth. This is called a Hawley, and the next kind is called an Essex, or an invisible retainer. This looks almost like an Invisalign tray. It's clear, it doesn't cover the roof of your mouth. This one's particularly good if you grind your teeth. It'll protect your teeth against wearing down, wearing away. If you have any TMJ symptoms, it can help with that too because it kind of acts like a night guard. Okay, so to clean your retainers, you want to be very gentle with them. You don't want to be too aggressive. You don't want to scrub them too hard because you'll scratch up the plastic or the acrylic and you'll get more stuff accumulating in there. So you want to be very gentle. You can use either a soft toothbrush, just like you should be using on your teeth, and hand soap, or you can use toothpaste, but you don't want anything too abrasive. You don't want any kind of like baking soda whitening, grainy kind of toothpaste. You want just something very plain and basic and gentle. I personally just use hand soap to clean my retainers, and you want to just brush them very gently. At the very least, every morning when you take them out, at the very least, you have to rinse all your saliva off of the retainers, and you want to use just room temperature or cool water. You never want to use hot water or boiling water with them. Don't put them in the dishwasher to clean them. I've actually had somebody ask me that. Don't do that because it can warp them. And you can also use denture cleaners, so those little denture tablets, as long as you're not allergic. If you don't have a sulfa allergy, You can use those denture tablets. You just put them in water, let them fizz up, put your retainers in there, leave them in for about 10 minutes, take them out, and just gently brush them off. You don't have to worry about drying them, really well. I had somebody tell me that they were drying them really aggressively and broke them. So you just want to be very gentle with them. They are fragile, so you want to just be very careful with them. Don't leave them around any dogs. If you guys have dogs, it's a dog magnet. Retainers and homework, I don't know, dogs just love them, so keep it away from the dogs. The number one most common reason people have to get new retainers is that they put it in a napkin and then it just looked like trash and either they or somebody else threw it away. So never ever put it in a napkin or paper towel. Make sure whenever it's not in your mouth, it's in your case. Back in the day, they used to say you have to wear them all the time. And some orthodontists might still do that. Different orthodontists have different protocol. But there's been a lot of research done in the past 30 years that has shown that wearing your retainers, for the majority of the people, wearing your retainers 12 hours a day or at night is just as good as wearing them all the time. And then you have less risk of, leaving them in the lunch tray, putting them in a napkin while you're out and about and then it getting thrown away. So for the majority of people, nighttime wear 12 hours is enough. There are some people whose teeth are super duper stubborn, and those people do need to wear them a little bit more often. But for the majority of people, nighttime wear. Like I said, the first 2 years super important, but you do have to wear your retainers throughout the rest of your life because teeth are always moving. Teeth always have a memory and want to go back to how they first started. So the first couple years, it's very crucial. Third year, maybe you can wear them just while you're sleeping, 6 to 8 hours. After that, you do need to wear them every once in a while, forever. You might get to a point where you're only wearing them maybe once a week. But if you just completely stop wearing your retainers altogether, eventually, slowly but surely, your teeth are gonna move back to how they started. The crowding's gonna come back, the spaces are gonna come back, the rotations are gonna come back, and then you're gonna need to get braces again or Invisalign, which is what happened to me when I had braces when I was younger. I didn't wear my retainers the way I was supposed to. I was not a good patient. And what I did was eventually I had to get, I did Invisalign on myself. And now I wear my retainers every single night. I don't even skip one night. I take them with me when I travel. I never miss a night because I don't want to get braces or Invisalign again. So learn from my mistakes. Don't make the same mistakes I did, and just make sure you wear your retainers every night.